All right, if we can move into public comment at this time, and we will start with the in-person comments.
Sure. Let me read
Please do.
the note about citizen participation, Mr. President. Thank you. Citizens wishing to address the board on agenda and non-agenda items for action can submit a virtual blue card that will be posted at 4 p.m. on Monday, August 23rd, 2021 on the district's website or in person by 7:10 p.m. by submitting a blue card to the board secretary. The board may not be in a position to respond to non-agenda items. Therefore, speakers should not anticipate an immediate response to their comments or questions. For the benefit of all concerned, do not mention the names of students or school district employees. Please keep your comments as brief as possible. The board president reserves the right to limit times.
I have set up a timer for 2 minutes and 45 seconds, just so I can let people know when it's time to start wrapping things up. If we could go ahead with the first comment.
Mrs. Margaret Cada?
I'm Margaret Cada. I have students at Etzel Ford this year and Whitmore Bowles. I grew up in Dearborn. I went to Dearborn Public Schools. I've literally never lived anywhere else. I've always worked here. As a mom of kids that have always done great in Dearborn schools, I have straight A students and everything, I just wanted to come up here and say, we've tried to be supportive as parents for the past year of all of the mask mandates and everything that's been going on. But with all of the new statistics and facts and things that have come out, I printed all of this off of your guys' website, so it's all off Dearborn Public Schools, but all the numbers just don't really add up for any of us parents. I'm sure I'm going to be speaking not just for myself, but for everyone sitting back here. But when you kind of look at all of the numbers that you guys have given us, we're talking about total numbers of cases, and that's obviously including adults, because you haven't separated anything out into children. And the issues that I think all of us adult parents have is that we should stop grouping our kids into this number of adults who have pre-existing comorbidities and things that are contributing to them having negative effects with COVID, because our kids, like I heard someone say earlier, have been hanging out with each other all summer. No one's gotten sick. This has been going on for a year. Our kids have been hanging out outside of school without masks. It's just getting to the point now where it just seems like a sham. We don't need to continue to follow the recommendations when, there aren't actual numbers to back up the pediatric cases. And if you can show us some actual numbers of kids from Wayne County, specifically children that have been affected, that is a big enough number to make us feel as parents that this is something that we need to do with the mask mandates and the vaccinations, which I guarantee you none of us are doing. But then maybe we would listen. But right now we're going off of things like, from your page, this little document right here, in the past 2 months or month or whatever this little chart is, there have been the death rate, which is what's important, let's not forget, there have been 12 total cases, total in all of COVID, of children. I would like to know, of those 12 children, what was wrong with them beforehand? Did they have asthma? Were they sick from other things? Were they obese? All of these things factor into it. And it's just kind of getting to the point where us as parents, we're just sick of it, because our kids are healthy, they're fine. And we're not judging you guys. We know you have to go off of CDC recommendations and things like that. But just keep in mind that there's 21,000 students in Dearborn Public Schools, and how many of our students have been sick with this? How many have gone to the hospital and been hospitalized? Kids get the flu every year, okay? How many kids got the flu this last year?
I just got over it. Did you?
Okay. So the bottom line is, we can wear our little cloth masks. That's the same fabric as our t-shirts. We can continue to make our own little rules up about how an aerosol virus transmits. But the bottom line is, it's an aerosol virus. These masks, no offense to you guys, but the masks that everyone's wearing don't stop the virus, period. It is a virus. It is going to continue to be contracted just like the flu. Every year there will be a new variant. We can't continue to mask up our kids who are not the ones transmitting this virus. For what? The mask does nothing. If the mask worked, why would there still be cases? There wouldn't be. It's pretty simple logic. It's just, it's getting to the point where we're all very angry, and to see that our kids are gonna have to go back and wear masks, I mean, there's gonna be a lot of parents that are just gonna be pulling their kids out of the system. And I mean, I don't wanna do it. I love Dearborn. I'm a Dearborn born and raised student. It's just the way it's gonna be. I've talked to so many of my kids' friends' parents, and everyone is just floored with this decision. So I hope that you keep in mind that none of us want it. Maybe send out an actual survey and say, do you want your kids wearing masks or not? Yes or no answers, and take that into account, because I bet majority of the 21,000 students' parents don't want them in a mask.
Thanks.
That's all I can say about it.
Mrs. Stephanie Butler wants to come up and speak about mask mandates.
So, I have something written out, but I just have to say too, I think the gentleman mentioned that we don't wear masks outside when it's kids, but beg your pardon, that my elementary students at Duval did in fact have to wear a mask outside for recess. So there was no point in the day when they were there on a Tuesday and Thursday that they didn't have to wear a mask. My 6-year-old son. And I tell you what, and I'm gonna tell you something, St. Anselm's is full because all parents are moving their kids out of this district. I moved my elementary students out of this district, and I'm about to move my 2 junior and senior from Etzel Ford. You lost your principal, you lost your assistant principal, you lost the office staff, the athletic director. I mean, I don't understand what's going on, but I tell you the turning point for me when I said enough's enough. When my baby went to school on a Thursday in 90-degree weather and came home by Saturday morning, we were in the hospital with croup from the mask and the sweat and the bacteria under his face. 6 years old. I mean, I'm angry. So that brings me to this. We parents have had enough of the forced mandates, knee-jerk reactions, and government overreach into decision-making regarding the well-being of our children. We will not co-parent with the government or Dearborn Public Schools. We have watched our children succumb to harm at the hands of government, special interest groups, and inept leaders, and we will not tolerate the continuation of it. We believe in choice and parental rights. We believe that all children should have the right to an education free from mandates that have not been proven necessary or beneficial. Universal and one-size-fits-all approaches have failed Michigan school children. Children are not political pawns, and our tax dollars are not to be used to cater to the demands of special interest groups, unions, or any other political organization. As we enter the 2021-22 school year, parents must have a choice. Education will not be conditioned upon wearing a mask, scheduled COVID testing, or vaccination status. Our children will not be mandated to miss school for 14 days due to close contact quarantines. Parents will be the decision makers for the health and well-being of our children, and we will no longer remain silent. We will stand up for our children and their rights. To the school board, school administration, local government leaders, and business who have respected parental choice, we applaud you. We anticipate and appreciate your continued support of children and our rights as parents to do what is best for them as individuals. We do not wish to take away from the learning environment of any child. For the officials who do not support parents and our right to choose, please take note. Our voices, our votes, our dollars will be redirected to the schools, candidates, and businesses that support Michigan's parents and students. Calls for mandates, lockdown, and universal masking in schools are not rooted in science and have caused significant harm to the most vulnerable in our state.
Please wrap up if
We
possible.
parents have made this known to you for over a year, and yet our message continues to be one of authority and cruelty, disregarding the social and emotional well-being of Michigan's 1.4 million students. So enough of the fear, political agendas, and bad science. We did not lay with you to make our children, so you let us decide what is best for our children.
Mr. Billy Salome wants to speak about mask mandates and other mandates.
How you doing, folks? My name is Billy Salome. My wife is a teacher at Lorry's, teaches special ed. She's been there about 14 years, going on her 14th year. My kids, last year, they attended private schools because we follow data, real data. So last year in August, we knew from numbers from the government that 29 countries had opened up for schools. Not one case transmission took place. Those kids should have been in school last year. We knew that. We knew that this was going to happen. So we put our kids in private school last year, and they didn't miss a year of school. And nothing happened at the school. My son went to a school where the masks were required on the way in and on the way out because they understood that the mask actually caused more problems than they did for somebody that age. Now, I watched the data presentation from the lady. Just to let you know, the data that she presented is so flawed because the CDC and the FDA have pulled the test. So you guys know there is no test that you can test for this virus. Now, if you're basing the test off of data, 80% of those tests, 80% come positive for influenza A and influenza B. So how do we trust that? How is that what we're basing sending our kids back to school on when the data doesn't fit? So when you have a test that you can actually say clearly, this is a COVID positive, not an influenza A or influenza B, you know the tests have been recalled. You know there's not another test due to the 31st of this year, if that comes. More importantly, by mandating this mask, this is directly from the School Code excerpt, Act 451, 1976. 380-1307B, Statement Prohibited Practices. The state policy under section 1307A shall include a clear statement that all the following practices are prohibited for school personnel in public schools of this state and under all circumstances, including emergency situations. This includes child abuse. This includes mechanical restraints, chemical restraints, any restraint that negatively impacts breathing, prone restraints, physical restraints other than emergency physical restraints, and any other type of restraint. This is a medical device. So if you guys want our kids to wear a medical device, we want you to sign off on a waiver that if these kids get sick from the medical device, it's on you. So we're putting you on notice now, and I will serve you in 1 week if you guys decide to do this. You are a violation. Done.
Thank you.
Miss Jillian Newry would like to speak about sports involving mask wearing.
Can I move this down a little bit?
Yes.
Hi. Hi, I'm Jillian Newry. I'm a student athlete from Etzel Ford, and I'm just here to talk about, you guys heard it from the parents, but they don't really know what it's like to be in school, wearing a mask. Etzel Ford has no air conditioning. You guys are expecting us to play sports in a 90-degree gym, be healthy. We can't even be healthy not wearing a mask right now. But you guys are expecting us to come off the court, come off the field, come off whatever sport you're playing, and be able to breathe wearing this over our mouth, when we can't even do it without a mask. Girls on the volleyball team right now, we're throwing up, we're passing out, we're having anxiety attacks, having panic attacks. No one cares about that though. You guys are caring about these protecting us when all this is gonna do is make us more sick than we already are getting in the 90-degree gyms. If you want us to wear this, then give us AC. Give us some cold air that we can have so we can actually, that we can actually breathe when we're playing the sports. You've heard it from the parents, but they don't know what it's like. They're hearing it from their kids, but I'm here because I'm sick and tired of having to worry if I'm gonna be able to make it through the whole practice of throwing up, passing out, hyperventilating, whatever. So whatever you guys take from what I just said right now, I really hope you actually take it because I'm experiencing it firsthand. None of you guys are, none of them are, I am. So I really hope whatever you got from whatever I just said, I really hope it changes your mind of what this is gonna do for us, because what this is gonna do is make us more sick. It's gonna higher those numbers that you guys showed on the data up there. I'm not a COVID expert. I'm 16 years old. I got more important things to do in my life than study COVID. But I can tell you this is not gonna do anything but make us more sick than we already are getting, and it's gonna add to that data that's not even accurate. You've heard it from the gentleman, you heard it from that lady back there. So again, whatever you guys take from whatever I just said, I really hope it influences you guys to get rid of this or make it our choice. This is our choice if we wanna wear it. Thank you.
Thank you for your comments.
Mr. Steve Newry, he would like to speak about masks, CRT, and COVID.
Thank you. Just a little tidbit here. I gotta take my glasses off, I can't see. There have been 4,413,547 positive COVID cases of children 0 to 18 years of age, with 423 deaths. These figures are from January of last year to August 11th of this year. That is a survival rate of 99.99981%. And I don't know about you, if I got them kind of grades in school, my parents would be really happy with me. I don't want to say that any child's death is good. It's not. But the survival rate is amazing. It's great. This may be a little higher because a lot of kids have many COVID tests. They test positive 3 or 4 times. It could be a little bit lower. You guys get your information from the Michigan Health Department, correct?
It's one of several
Bueller,
sources.
yes, is that correct?
Yes.
Where do they get their information from? CDC? Am I correct in that assumption? Am I correct?
Possibly.
Please, yes or no. Can I
Possibly.
answer the question?
Possibly.
It's a yes or no question. Do you know?
I do not know.
So, okay, so then you guys have all these meetings, but let me give you a little bit of information is. If you get your information from the CDC, let me ask you this. This is the same CDC that has said nothing about the 2 million immigrants that have come across the border that are testing 30% positive for COVID. These are the ones that they are capturing. The ones that get away, it could be a lot higher than that. This is the same CDC that has doubled the cases of COVID in Florida and admitted it only when Florida called them out on it. This is the same DC that never said anything about Obama's birthday party with 500 guests, no mask. This is the same CDC that said nothing about Lollapalooza in Chicago that drew hundreds of thousands of people, no mask. This is the same CDC that said nothing about Congress the Congress from Texas that flew to Washington, D.C. No mask. This is the same CDC. This is the same CDC that has done no studies on the effects of COVID on kids 0 to 18. No, there is no studies out there of masks and how they affect kids 0 to 18 or can they transfer. You guys are making decisions with no information. There's no studies out there, none. So, if you guys are going to court and you said this person's guilty, well, where's your evidence? There is no evidence. The judge will laugh you out of things. You guys are making decisions. The health department's making decisions. The CDC's making decisions on no evidence whatsoever. There is no evidence out there, none whatsoever. So you guys need to rethink this because you know what? You guys don't care about the students out there. Us parents do. You guys sit here with your condescending looks on your face and you guys don't care about these kids. None of you guys care. I ain't even gonna go there. The thing is, you guys need to wake up and realize that and you made a great presentation about the guy that brought you on. The children are the most important things, not the adults. You mentioned that. You're the superintendent, and I think you forgot what that guy taught you. Because you're looking at me like I'm an idiot, and you could care less of what I'm saying. And that's how these parents feel, that you guys do not even care about what these kids go through or what they got to do or what we got to do. You guys just think you can sit up here on your thrones and do whatever you want to do, no matter what we say or no matter what we feel about anything. And that is wrong. You guys should be ashamed of yourselves. And I tell you what, next school board election, there will not be any of you sitting on that board right now.
Thank you.
Sarah Ford would like to speak about masks. Sarah Ford.
Hello, I brought you guys a box of masks, so you can read the warning label on the side. You might want to pass it around. After the last board meeting, I decided to look up what exactly you school board members do. I found out you do many things like approve budgets, set goals for the district, and represent the parents of the communities. At the end of the last meeting, I heard a few board members say they didn't want to revisit the mask issue, but it's a big issue and we're here again. The more board members that don't care to talk about mask issues don't have kids currently in the district, nor have they had school-age children go through this pandemic. When the board members send videos to social media, it diminishes the parents, and the school board is supposed to represent us. In my opinion, if you can't handle a few angry parents, you probably shouldn't be on the board. We voted you in, not the teacher unions. Us parents haven't forgotten this. We hope you haven't forgotten this. And we don't always have to agree on everything, but we deserve to be listened to and deserve to see the data you're using to make the medical decisions you're making for our children. The Michigan Legislature Revised Code Statement of Prohibited Practices 1307B reads that all of the following practices are prohibited for school personnel in the public schools of this state under all circumstances, including emergency situations, and that includes any restraint that negatively impacts breathing. I argue that masks negatively impact breathing. From 2019 to August 4th, 2021, there were 349 COVID deaths of children ages 0 to 17. During the 2018-2019 flu season, there were 477 deaths in children ages 0 to 17. Yet we never masked our children for the influenza. So I'd like to know where your data is that these children have passed COVID to teachers. I mean, do you have any? No? Oh, okay. And then where's your data that shows that masks even work in these school settings? I mean, I don't even think the CDC has the exact data. So I'd like to, I looked at another study where a group of parents sent 6 face masks to the lab for analysis, and 5 out of the 6 masks were contaminated with bacteria, parasites, and fungi. No viruses were detected, even though the test could detect viruses. 11 dangerous pathogens were on the mask, including pneumonia, tuberculosis, meningitis, and Legionnaire's disease. These masks were freshly laundered and had been worn for 5 to 8 hours, a typical school day for most children. So I had picked out that box so you could see that there is a warning label on the side that says, this mask is not a respirator. This mask does not eliminate the risk of contracting any disease or infection. Replace if damaged or soiled with blood or other bodily fluids. So I'd like to ask if you guys are gonna make the kids wear these masks in gym class?
If it's indoors, yes.
Okay, are you gonna give them new masks after they sweat through their masks that they were?
It's something we could talk about.
Okay. I just have another couple
Please
questions.
wait to speak until you're at the podium.
We're together, so we can have 6 minutes. I assume that's the rules, correct?
Yes.
Okay. If you're gonna make them wear masks, why can't we do like the restaurants do, and the kids wear them in the hallways and go sit in their seat and take the masks off?
Or like when you speak, you take your mask off.
I mean,
So the kids could hear their teachers as well.
are you gonna give the teachers microphones? Because when I hear people talk with a mask, I really can't even hear them. And then people start getting closer and closer. I mean, is that what we're doing, or how's that gonna work? Because some teachers talk quiet and then they have a mask on and you really can't understand them. So I'm just wondering, like, what's the deal with that?
And what's the difference between our kids in school or going to a restaurant together? Because that's what they do every single day. They hang out at our homes every single day together without a mask. So what is the difference? Because they're spending more hours in their houses together, but then you're gonna separate them in school with a mask on? What is the difference? No, I'm asking, what is the difference?
I'm writing down comments from different people, so when we bring everyone back together, we
Okay.
can ask some of these questions.
Okay.
What is going to happen if the kids won't wear a mask? What if I tell my child, or we tell our children, we do not want you to wear a mask? Right. What will happen? What will happen to our kids?
And also, I'm on a lot of, I'm on some pages, Facebook pages, where a lot of other districts have been speaking up. And they said that they have given these kids mask breaks. Now, I'm hoping in elementary school, when they go on to recess, they don't have to wear their mask. Do they have
But
to?
unfortunately, we heard that they do have to wear masks, so.
Okay,
The policy that we just talked about was that no masks when they are outside.
okay, but I have children in high school. Are you gonna give them a break a couple times a day to maybe go outside and get some fresh air?
We can ask once we're done with the public
Or
comment.
even elementary school students through the thick of summer, they had to wear a mask outside. Don't you think that's unsafe? Can you really think about that and think as a person, as a human, that it's better for a child to wear a mask when they're playing outside in 90-degree weather? That's safer?
It just doesn't make sense,
doesn't make
guys.
sense.
I mean,
At all.
it doesn't make sense.
We're asking
The whole
for a
thing.
choice, that's it.
I mean, we would even say, put the mask on in the hallways, then get to your seat and sit down. You can take it off. I mean, that's what the restaurants do. They're able to open. Why can't, why can't our kids do that? It's just, there's something to think about if you're gonna force these masks. I mean, they don't do anything. The data's there. I don't know what data you're following. If you want to give it to me, I'd look it over, but it's just like, it's just ridiculous at this point. And I'd like to know your enrollment numbers, because I think a lot of people have been pulling their kids, and I can't find them for this year, so I don't know. Do you guys have them?
We won't have the enrollment numbers until October.
The official count comes out in
Or
October.
how many parents are on your boards? How many parents do you guys include in these decision-making sessions that you have? No, seriously, how many parents are on your task forces?
You mean how many of us have kids in the district?
No, I'm not asking for,
No,
no, how many of us? How many parents of Dearborn Public School parents are on your task force?
I would have to look it up. I don't know off the top of my head. And it has been the 6 minutes.
We're done.
So
Thank you.
thank you.
Angie Hammock would like to speak about, oh, okay. Thank you, Angie. Crystal Paulson?
Hello, my name's Crystal Paulson. I'm speaking for my son who's 16 at Etzel. So some of you don't know, my husband's actually a frontline worker. He worked during the pandemic. I'm not gonna state where he works. Some do know where he works. When you guys do cross-tracing or cross-tracking or whatever it is, my husband's actually exempt from that. My household is exempt because he's a frontline worker. He doesn't have to quarantine. We don't have to quarantine. So the hypocrisy with what's being said, it doesn't make sense, especially when I have an outside and then I have an inside of what's going on at school. So if you could see my position, I'm trying to find logic, but nothing is making sense. So I will say that, okay? But my son last year, his JV football game, I think it was the third game in, he passed out. I had to take him to the emergency room. He was treated at St. Joseph's Lanning Hospital. He was tested, his blood levels came back with elevated CO2 levels. You wanna know what the doctor told me, what it was from? Take a guess. Someone please answer me. Wearing a mask. My son was treated for CO2 poisoning from constricted airway. My son does not want to wear a mask. My son is intelligent and he is smart and he's old enough to make that decision on him for himself. He doesn't want the vaccine. He said in order for him, if he had to get it, they would have to force him. This is what my 16-year-old son, I'm not an anti-vaxxer. My kids are up to date with all their vaccinations. My son has asthma. My youngest has autism. I'm a mother, and that is my full-time job, is taking care of my children. My children are sick, they do not go to school. But there are several parents in this community that has sent their kids to school numerous times knowing that their child had a stomach virus, had the flu. I mean, everybody remember the stomach viruses. The whole entire household, one by one, everyone goes down. What is the difference from then to now? Because they got really sick before COVID, and I don't know any child that has been deathly ill with COVID. It's not fair. It is not fair. These are our children. I'm only speaking for my child. I'm not speaking for anyone else. My child deserves to have that choice for himself. And I will tell you, I did take out my second child. He goes to Tipton Academy. They don't have masks this year. They're not pushing vaccines because it's parents' choice. They didn't have one COVID case transmission throughout the entire school year. Why is that? And I wonder why. I actually had the superintendent from the school call me and tell me to stop recommending the school because their waiting list is almost a year out. My son has a lot of his friends in his class now because I told their parents that there was another choice than Dearborn schools. Much respect, Mr. Barry, but you guys need to remember, we voted. We voted, not the kids, we voted. We have every opportunity and choices. If we want to recall or unseat, we have that choice. Don't push us. Thank you.
Thank you.
Ms. Jane Mazza would like to speak about mask mandates.
Hi, good evening, President Thorpe, Dr. Malenko, School Board Trustees. My name is Jane Mazza. I'm President of the Dearborn Federation of Teachers Union, Local 681. I'm addressing the board on a few topics. One is to respond to statements made at the last school board meeting in July about teachers and the learning environment for students. The last school year was difficult for both staff and students. Staff were teaching and working in a crisis environment. Teachers worked very hard to ensure all students had access to learning materials, dropping off supplies at students' homes, volunteering at schools before and after scheduled workdays to make sure all students had Chromebooks and other materials that they needed to take part in remote learning. The district also provided learning labs for any students that needed extra support. And teachers taught small groups of students during those learning lab times, as well as additional time contacting parents and caregivers that requested extra support. All students could reach out to their teachers for support, and support was given. Dearborn staff has always gone above and beyond in helping our students achieve their goals. As we move into a new school year, we once again are faced with a terrible virus, COVID and its variants. We know that students learn best when attending class in person with their teachers and peers. To keep both staff and students safe, I'm requesting that Dearborn Public Schools mandate masks for all. The combination of mandatory mask wearing and vaccination for those who are able to receive the vaccine are two huge steps in combating this deadly virus. Continuing the school's policy of cleaning, mitigation, and social distancing where possible will reduce the chance of an outbreak. We need to work together to minimize the risk of this virus spreading. I know everyone here today loves their children and wants the best for them. We also need to love all our children in Dearborn. We need to love them all. And wearing a mask and getting the vaccine is the one way to keep us all safe. Thank you.
Reagan Ford.
Everyone has a chance to make a comment. Please be respectful of others.
So last month, about 40, 50 of us come here. We were all angry. And we had hope. We came here under the guise that we were going to speak to this board about masks. And we came back tonight under the guise that we were going to speak to this board about masks because we were under the assumption that it was you guys who made the rules. Little did we know it was the man over here who's been laughing at us for 45 minutes that just come up and told us the plan. Do you guys get to vote on that plan, or is it just his word?
We get to make any decisions.
You get to vote on it? Because the way it was just presented to all of us was, this is what we're going to do. Here it is. You're wearing masks.
It is the recommendation.
It's a recommendation because it was presented as here's your plan. Teacher union donated this much. They want this. This is our plan, says the teachers. I mean, we can obviously tell the donations from the teachers union isn't what the parents gave. What are we doing here? I don't even know what to say. I really don't. I'm very upset. The parents, we came here hoping that we'd be heard. We were even a little more louder than you'd like, I understand. And then they just come up here and present this program that says, nope, you're wearing masks. Here's how we're rolling it out come September. Is there a vote on this? That's an actual question. Is there's a vote on if we get to accept this?
We will have a chance to have the discussion. I wanted to let everyone in the public have a chance to speak first.
A discussion or a vote?
It's a discussion. We can choose if we want to vote.
If it's a recommendation, why are you mandating?
I was hoping teachers would have a better say, but all I can see here is it's a few people from the administration and the teachers union, and I'm very upset about it. So is everybody in this building. I know most of you up here, I'm just very disappointed. The gentleman talked about the glove, the rubber glove in the water. I don't think it's a bureaucrat's job to tell my kid if he puts the rubber glove on. I'll make that decision. Same thing with the masks. Rubber glove might be a great idea, but I don't want some guy who lives in Livonia, wherever the hell they're from, to tell me to do it. I want to tell my son to put it on. If you want to wear a mask, if you're concerned, wear the mask. It's the simplest solution is right in front of you. And it's what thousands of districts around the United States are doing.
Can I just say one thing? Regan, and we've known each other
Yeah.
for quite a while. There seems to be a misconception, number one, about what the mask's purpose is. It's not about us keeping your germs off of us, it's about us keeping our germs off of you. Okay, so no, I'm going to speak now. You're saying that it's your personal liberties to go ahead and mask or not mask infringes upon other people's personal liberties. It's similar to the smoking ban.
They had the decision to stay home.
Why should will you all wait and listen to what we hear from parents who have an opposite view, which we will be reading soon, who wrote in? Because you're not the only opinion
We're the only
in the
one
room.
here, Mary.
No, the other people chose to
The other people are too scared.
write in. I'm
All
not
right.
going to make that decision. I'm just saying
Trustee
you need to hear
Pavlichkov,
other people.
Let's wait until we get all the
Yeah.
comments done.
Last thing I want to say is for the last 20 years, a killer of children, way worse is what I should say, way worse than COVID, takes the lives, on average, of over 450 children every year in the United States. It's called the influenza. It's been happening since the beginning of time. Never once have we put a mask on a kid. Never once have we told kids to stay. Never once have we panicked like we've been panicking the last 2 years. Never once have we social distanced, knowing that 450 children are going to be sent to school every morning and are not going to come back sometime throughout the year. A virus that kills children on a way disproportionate level, less, the data speaks to that, and we are just losing our minds, panicking with all these regulations, and it doesn't make sense to me. We'll talk later.
Thanks.
I have, a blue card was filled out by Annalise Heaton, and she would like to, she would like me to read her comment. Please do not mandate mask wearing in elementary schools. Please give families freedom of choice. And then lastly, we have Miss Sam Lukeman, that she would like to speak to the board about special education.
Good evening, everybody. My name is Sam Lookman, Samara Lookman. I'm a pro bono special education advocate for families. I ask families to reach out to me, samaralookman@gmail.com, if they need assistance with their IEPs or anything regarding the district. I want to just first compliment the teachers for all their hard work during the pandemic. They've been underpaid, overworked, and I especially appreciate them. I watched my 4-year-old attend class with a teacher who was preschooler trying to juggle 14 preschool children online. It was hard. I mean, I'm a single mom. I have a 2-year-old, a 5-year-old, 2 jobs, and me becoming a teacher on top of all of that was difficult. But it was not any more difficult than what special education students and their families had to endure during this pandemic. We've watched parents overnight of those families turn into social workers, occupational therapists, teachers, nurses, everything in order to help their children succeed. And in spite of this, sadly, our students with disabilities in this district have regressed. I know, I've seen it personally. I've advocated for them. I still continue to do so. That only tells me that there have been inefficacies in our contingency plans for those students. And I can tell you from one of the IEPs I attended, a renewal earlier this year in May, an administrator told me, and I'm quoting him, "What did you expect us to do? Go to every family's homes to service these kids?" Now, I understand the frustration, and I understand that the lack of direction when COVID hit and the state shut down in March 2020. But you had 6 months as a district to get that act together in order to ensure these students with disabilities would correctly get service by September 2020. And sadly, that did not occur. I understand that we push No Child Left Behind. We hired a superintendent whose dissertation was on that. We were here today paying tribute to John Artis for implementing that into our school system. And I'm asking you as a board to put that into practice going forward, to ensure that there's accountability for our district in taking care of our students with disabilities. I wish to recognize the resilience of those parents and families, but moving forward, I'm asking this board to ensure we have a plan for those kids and our at-risk and most vulnerable students do not get left behind. Thank you very much for your time.
Thank you. That's it for the person.